is to automate medication management process in all healthcare system using our IoT-based medcase. And our mission is to provide medcase to all the healthcare institutes to make the management system effortless and error-free. Okay, so let's come to the problem. So I have seen in my home that my parents and my grandparents, they often forget to take their medicine. So I have to write it in a sheet and staple it to the medicine that you have to take this at this time and before food or after food. So you must have seen the same problem in your house. So we are trying to solve that missed medication. And according to WHO, around 52% of adult population forget to take their medicine in time. And the number is even higher for higher age group. And there is no efficient system in the market that can monitor the patient's medication regularly. So we are introducing Medcase, an IoT-based automatic medicine pill dispenser that not only dispenses medicine in time but also ensures, tracks, and reminds for the patient's medication. So these are the some key aspects of Medcase. It is a medicine reminder, but it also prevents the patient to take the wrong medicine. And it has only a single button, and it has a user-friendly mobile and desktop application. It also gives before food and after food medication notification. We are giving 30 days of storage with low pill count alert, and we are giving 12 plus hour battery backup, and it can also be integrated with Amazon Alexa. So these are some key competitors that are existing in the market. Coming to the competitor analysis, we have some key aspects like prevention of wrong medicine. So in the other competitors' products, people can take wrong medicine by manually opening up the box. But in our system, the wrong box won't get opened. So the patient will always take the right medicine. And we are giving after food medicine or before food medicine reminder. And we are giving a easy refilling process that in one slot you have to put only one medicine. In some other devices, in one slot you have to put different medicine. So again, the caretaker has to select what medicine to fill into what boxes. So coming to the market size, there are 70 million patients in India that is only suffering from diabetes, and the number is 530 million globally. And at a compounding rate of 6% in a year, it is a never-ending market. So these are our target markets. So in B2B, we'll be targeting hospital chains, pharmaceutical stores, healthcares, and NGOs. In B2C, we'll try to provide medicines through e-commerce and e-pharmacy platforms. And in B2G, we'll target medical healthcares. So these will be the go-to-market strategy. For hospitals, so we are trying to place one medcase beside one bed so that the patient will get accommodated with the medcase. So the patient will get benefited from the medcase, and also the management system for the hospital will get much easier to track if the patient takes the right medicine or not. So after that, if the patient feels ease to use the medcase, he can purchase one from the stores inside the hospitals. And for pharmaceutical stores, we are partnering with Apollo Healthcare or MedPlus, such bigger pharmaceutical stores, to sell our products over their supply chains. And for retail customers, we are talking with Polvar. We will be partnering with Polvar, who has more than 5,000 salesperson within India, and they will go to like house to house to sell medicines. So currently we are in piloting stage. We have done all the R&D and prototyping. We are piloting this product, and we'll be going into manufacturing process. So these are the timelines, and in the 9th month from today, we'll be starting selling this product. So these are the total addressable market. So globally, this is 50 crore market, and in India it is 6.6 crore. So if you are capturing only 5% of the market, then we'll be getting the revenue that means. So these are some of the interested customers still we have got LOIs from 2050 healthcares and Fulbright organization, total of 2,500 LOIs with this 3D printed model. And the Well Group and Cosmotech Co Limited are Japanese companies. They are also interested in buying this product and integrate it into their hospital like bedsides. These are the sales projections for the next 5 years. So in total, we'll be selling around 5 lakh in next 5 years, 5 lakh of med cases. And this is the graphical representation of the revenue and cost. And these are our teams. We both are co-founders, and we have raised 15 lakhs 2 years back from an angel investor, Subhas investor, and we have technical advisor and financial advisor as Vivian Fund in Devasis investor. That's all from our end.
So what exactly you are looking for?
We are looking for funds.
Sorry,
Funding.
you're looking for funding. How much funding you are looking for and why?
To start the manufacturing process, we have to do the iron cast molding and to manufacture at least 5,000 pieces so that it financially makes some sense. So for that, to accumulate that cost, we are looking for funding. Because we already have interested customers, but when they are asking us for a couple of demo pieces or something, we have to give them these current box. And it is made in home with 3D printing and just painted. So we cannot give a customer like this product like that. So currently, healthcare 2050, like we have shown, they have 22 old age home centers spanning India. And Well Group, that is from Japan, they also operate old age homes in Japan. And we are interested in Japan because the birth rate is declining in that country, and more than 60% of the population is at age of 65 or more. And we spoke to the Cosmotech, they are one of the leading medical device manufacturers of the country. Currently, they don't have any kind of management system that monitors this medication process automatically. Everything is being done same the old manual way. So we have those two partners from Japan and this partner from India. But currently, we need to start manufacturing so that we can fulfill the.
I have got couple of suggestions, but even though I'll ask only two questions.
Sure.
A, how are you different than others?
Sure.
There are a lot of players in the market. B, for an example, if somebody is willing to invest in you, you want to manufacture this, why they will do that in India? Instead of that, there are better countries. Example, if you look at Vietnam, which is more of like growing like anything, you cannot actually compete with their pricing. Plus the country law, which is more flexible. Even though we have Make in India, that's fine.
Okay.
Are you guys ready to probably go for as a technology company instead of your own manufacturing unit? So if yes, then how are you going to protect your technology? Is it patented, you have applied, or if you have applied, is it design patent, is it technology patent, what it is?
Okay. So to answer your first question, how are we different from the competitors? To answer that, it comes to two things. First thing is the competitors. In the competitors' product, you cannot control, you cannot deny the patient not to take the wrong medicine. If the patient takes the wrong medicine, you will get notified as the caretaker. But in Medcase, you means that there is no chance that a patient can take the wrong medicine. The system is opening in a way like that. And from a pricing point of view, some of the competitors who are solving this issue, they have two things to look for. One is they are opening the pill from the original strip. And we have consulted many doctors and pharmaceutical centers. Once you open the pill from its original cell, you cannot revalidate that authenticity of that pill, no matter how medical graded plastic you are keeping in that. So we are not opening of the pill or anything. So it makes two things confirm that we are not tampering with the pill, any authenticity of the pill chemically, and it's easier to refill. And that product I am particularly talking about, it's a Hero Medicine dispenser we can do. So
Can I
that,
ask you to hold on and probably let me understand? Both of you are coming from tech background
No, he is from tech background.
and you are
I am from marketing.
marketing background, but you are looking for a co-founder in marketing.
Yes, no, we are looking for someone who has experience in this particular domain. Like if someone has been leading the Apollo Sugar Clinic in a journal range for a couple of years, maybe we can use their experience while tapping into the
In
market.
one liner, I need one liner answer for my question. Can I get that?
Sure.
Two questions I asked you.
Yeah. So the first question I was trying to show how we are different.
Hmm.
And coming to your second question, we already spoke with Cosmotech, so they have manufacturing plants in Japan and Vietnam. The meeting was on 29th of January, so it's just a couple of days. We are currently figuring out how to proceed with the global NDA. Once we finalize that, we are already in process to manufacture this product via them, and they have manufacturing plants both in Japan and Vietnam, as you just said. So once we finalize this deal, maybe the cost will be coming down. We don't know, but yes, we are in that.
Actually, if you're in talk with Japan and Japanese company, you actually don't need to find for any kind of investment. These kind of companies, they have a business acceleration model wherein they only invest in the company itself. For that, you just need to do a very good legalization with a NDA signed, blocking your technology, protecting your technology, and then relax.
Currently, we have the patent for the technology. And
Sure.
Yes.
Applied or got?
Applied.
Applied.
Yes.
Only one patent you had applied.
Yes. Yes.
Only for the
Filed
technology.
already?
Yes.
Yes.
Can
We
I-
have applied in
Just
last.
show your prototype.
Uh,
Like, is it already filed?
Filed.
Can you show the filing page?
Sure. We'll just show the prototype and then.
This is a file you can share in the.
Yeah.
No, here is not my laptop connected, so
Yeah.
it's a.
No, it's a Google search, right? You can try it out.
Yeah.
See if it is connected. And said that you have been technologically, it's been patented,
Yes.
not hardware, just design.
There is only the cover means
No,
the
it's technology patent.
plastic part is not patented, but the technology part means the box of the cover and all those things. Whatever.
So what he means and what I mean about technology is basically tech,
Tech,
not
Yes,
yeah.
The
I
tech.
get it.
Yeah.
The process patent, the way it operates. Yes. Thank you. So this is the box, and when the time comes, the alarm will pause with a green light. The patient has to press this button. Yeah. So when you press this button, that's what will only open. So we have to set the timing once only, then it will run forever.
So how you will put it in the medicine so that it will be poured and that is poured?
So you have to, in our application, the category has to set it after the photo.
So how
In
you
the
collect all the medicines and how they will, all the medicines, how you put it in the database?
So the category has to set the medicine name.
Timing.
Yes. Once you set
So
it,
you have to do it.
Yes.
Then need to do.
yes. But if you have a digitalized prescription, then you can integrate it to our database directly. You don't have to manually put it.
See, basically, I am worried about only one point when even you are presenting it before. See, you are telling like we are trying to make sure that patient doesn't take an wrong medicine. But again, that medicine is being placed by a human there. So if you see the WHO report, right? As per the WHO reports, it always happens because of human error.
Someone, yeah.
So it's not because of the device error. See, like, and most of the things in your go-to strategy also you are maintaining like in the hospitals. First of all, in the hospitals, they would go with the injections than with the medicines. It's very like once they come to the OP, then they use it. But when they are like intensive care or everywhere in ICU unit, they will never go with medicine as per my knowledge because I have been into medical domain for a quite bit. And second thing, so that one I am not so sure. And mostly, as you said, they can't tamper. But again, it's being controlled by a human, right? You don't have an IoT sensor in order inside where it can scan the medicine pill or something to see what is the chemical substances or anything.
Yeah, that's what I'm asking for.
So
We can do that, but again, that will take the price range to so high that a common person cannot.
And there is another doubt like we had faced 7-8 days back. If you are taking out some of the medicine from the packet or so stripper and you are putting in a different box, and after
Correct.
7 days someone is
We are
consuming.
not doing that. We are not doing that. You can just put the whole strip. or
that's the
you-
reason they have a bigger space block.
Yes.
We are not doing that.
But one thing is like I'm still doubted like when you are presenting it out, it might be just a small suggestion. If you see even the WHO reports, most of the patients die because of wrong medication.
Yes. We
But
are-
said that
yes.
your mission, even if it goes pricing high, if it's able to solve that problem, then I see the potential. But as of now, it's like a reminder box to me which I can place it in my app itself. and I don't need
but
to.
the same question, but imagine means why we started on this project. My parents are in Bhubaneshwar and I am in someplace else. They cannot, I cannot confirm that they have seen the reminder and they have taken the medicine. It's just a reminder.
How
and
do you
even,
see it here?
Yes, and even if it reminds them, how do a patient at say 70s or 80s would know this medicine is Rosinurgib, this medicine is this or that. So it's a convenient way to manage the medication.
You had a pain, you wanted to solve it, but the issue, what all of us are actually trying to give you, is not an issue of your device. It's an issue of someone who is going to give the medicine
Exactly.
and teach this particular device how to give the medicine.
Yes.
So if you look at the real time issue, so it's a pain point. I agree. Yeah, it's a pain point for everyone.
Everything someone is doing.
Yeah, but then, for an example, if your or maybe someone else's parent is like over 80s, because of Parkinson's, sometimes with Alzheimer, they can't even remember.
Correct.
Yeah.
So if you ask them to press a button, they will not remember that.
So it will, the
I
body
understand, but then what if you need to understand something which is called automation. If you are talking about automation, you are going for a patent, and that is on technology, then you need to understand how automation works actually. These people who are aged, we call them as a elderly care, whatever, For elderly care, it's very, very, very crucial thing. The problem happens from the person who is actually in your house, who is going to put the medicine inside the device, not the device at all. Which is what he is also trying to say, and I'm also trying to portray. So you need to find out a very sweet solution and a quick input regarding your pitch deck. Don't go for global data, man. Go for your own locality data.
Yeah, exactly.
It can be like maybe within 20 kilometers, 25 kilometers, 100 kilometers. Don't go for global data. We all understand that global data. Try to solve a very small issue. Your issue is very good. Like, I understood that is a pain point. Great. Yeah? We have a pain point. Now, how to solve it? Are you going to solve it, or are you going to be a company who is going to create the technology which will be outsourced to somebody else to solve the real-time issue? Find that first. Don't try to make yourself stretch like this big. It will be very difficult for you. If you are a tech company, be a tech company. Give it to someone who is running, like, for an example, the Japanese guys you are talking about. I can give you multiple number of those kind of companies who are based out of USA. Yeah? If your technology is worthwhile, they will go forward for that manufacturing. You don't need to think. They will reinvent the entire wheel. I'm not sure how many research you have done. You don't need to go far. You go to Southeast Asia, any damn country, go to their hospital. You will find out robots are actually controlling all this medication system.
Almost everything.
Yeah. You don't need to fly to Dubai. You don't need to fly to USA. Go to Southeast Asia, any small country. You'll find out that. That's the reason I asked you, how are you different, right? So try to find out that. Find out your niche, where you stand. If you are looking for manufacturing funding, I think there are countries who can give you that. Korea, example. Japan, example. Taiwan, example. There are manufacturing accelerators who are giving 100% money to the technology companies. It's called M&A that happens. Okay? Try to find out yourself what you want to be. Passion is great. You guys are passionate. Real-time issues are like you're dealing with human. And as a startup, when you deal with human, trust me on this, it's not that easy.
In India it is easy, but in Europe it is deadly.
It's deadly.
Even in India, it's too.
Very relaxed.
So what is
Go
the
to
cost,
Europe, you see it's
yeah,
deadly.
yeah.
Man,
Canada,
you'll be
US,
killed.
Yeah, yeah.
It's 10 years, 20 years ban.
10,000 rupees.